Welcome to the Alliance Healthcare Foundation's second Ask the Funder session on our 2024 Mission Support Grant application. My name is Barbara Orozco-Valdivia, and I am the Senior Director of Strategy and External Relations for Alliance Foundation. And I have a few colleagues with me today that are behind the scenes supporting this session. We have Melanie Mijares, our Program Associate, Karen Winston, our Director of Communications, and Anthony Gwynn, our Administrative Manager. For your reference, I'll be presenting for about 25 minutes, and then we will open it up for questions and answers. So let's start with some housekeeping. The session will be recorded in webinar mode with all attendees muted and off camera. Available, and this session will also be available on our Alliance Healthcare Foundation website. Zoom chat versus Q&A. Just to give you a little bit of a level setting on this, if you need technical support, please use the chat button to communicate with Anthony. If you're going to be submitting a question and answer for the question and answer portion of this session, please use the Q&A feature located on the bottom of your screen. We will not be answering any questions through the chat, but we will be answering them through the Q&A. And the reason why we do that is so that we can capture the questions being asked. And if we need to follow up with you directly, that's the easiest way that we can do that. So bottom line, use the chat for just technical support, working with Anthony. And if you're going to ask a question, please use the Q&A button on the bottom of your screen. So the areas that we're going to be covering today, we're going to be talking about the Mission Support Grant Program. And if that's the case, you're in the right spot. We're going to talk about a little bit of our application support, our online application portal, which we use as submittable, some helpful tips to help you complete the application, the evaluation that we'll be doing with the applications, the timeline, and a question answer period at the end. Granted, I am going to try my best to answer most of the questions that are going in the Q&A section. So, and if we don't get to your question, we will follow up with you directly. So a little bit about Alliance Healthcare Foundation. Our mission since 1982, we have worked to advance health equity in San Diego and Imperial counties through strategic grant making, impact investing, catalyzing innovation, community collaboration, and advocacy. Our vision, we envision a San Diego and an Imperial County region where equitable health resources lead to universal health and well-being. And we strive to reduce and ultimately eliminate disparities across all social determinants of health. And the reason why I'm bringing up this mission and vision is that we are looking for agencies that are mission aligned with us. And so if this works and sounds like something that you're working on, then you've come to the right place. So a little bit about our Mission Support Grant Program. It is a 3-year unrestricted for core operating support. And what we mean by that is once you receive the award grants, it's anything related to core operating support. It could be for staffing, it could be for programs, it could be for anything that you can make that makes your agency better. The awards can range from $25,000 to $100,000 per year, with the average award ranging from $25,000 to $50,000. And what I can add here is when we receive all the applications, we are going to allocate the amount that the awardees will get internally. It's an internal process. Another thing that I may also add here, it's let's say you get a grant for $25,000, you'll get that $25,000 for the 3 years, right? So for year 1, year 2, year 3. Our budget cycle is funded at $900,000 per year for a total of $2.7 million over the next 3 years. So we're allocating $900,000 in this cycle, which will be repeated in the next 2 years. We prioritize our funding in communities with greatest social and health inequities and with agencies who are led and are informed by the communities they serve. And another thing that I must add here, because we've got these questions through our emails and the last Ask the Funder, is that we're looking to award about 25 to 30 agencies in this cycle. So definitely it's a very competitive grant. So do your best when you're applying for this. A little bit about our mission support eligibility criteria. You need to be a 501c3 or a 501c3 fiscal sponsor. You need to be located and serve in San Diego County, aligned with our mission with clear ability to demonstrate impact, focused on closing equity gaps in social determinants of health, and a strong preference will be given to organizations who serve at least 60% or more of our Black, Indigenous, and people of color clients and communities. So who can apply? Our current mission support grantees, new grantees, and organizations previously funded by Alliance's other programs. So right here, I want to encourage any new grantees to definitely apply if they're a new nonprofit in San Diego or have been here a while. You know, we're welcome for everyone to apply as long as you meet our eligibility criteria. A couple other things. If your agency serves other counties besides San Diego, your agency still can apply. So we've gotten this question several times, like, well, what if I do the whole region of, you know, Southern California? Can we apply? Yes, you can apply. But you all know that if you are awarded, the funds need to stay in San Diego County. Another question we've been getting is if you serve San Diego and Imperial counties, you know, which one should I apply to? And the question is, I would apply for your service that you're doing in San Diego. I would apply for our San Diego Mission Support Grant. And our sister company, Imperial Valley Wellness Foundation, also has a mission support grant application open now, and their application cycle ends August 31st. So a little bit of support as you're going through our application. We have added a few things, including this Ask the Funder session. All of the information about our mission support grant can be available on our website at alliancehf.org. And then there's a little, you can see mission support grant, and there's a box there, and click on there. It will have our frequently asked questions, what we call FAQs, on the website. We have a PDF of all the application questions that we're asking, so you can download that too. We have this Ask the Funder session, and also office hours with our program team from August 1st to September 12th. We're allotting 15 minutes for office hours to ask for technical assistant questions of the application and the process. As I'm also going through this presentation, our team members behind the scenes are dropping these links for you so that you have them easily accessible. So, where is this application? Well, it lives in something we call Submittable. And Anthony is going to share the link to our application to Submittable. There's a couple things here with this application. We have 2 steps. The step 1, once you complete step 1, that's your intent to apply. And once you do that, you will receive an email to get you to step 2. So the question a lot I'm getting is, do we have to wait for you to approve us? No. Once you go from step 1, you'll get that email, and it'll have a link, and you can fill out the rest of the application. Most of the application is in step 2. And just some important dates that you need to understand. We did open up this grant July 5th. We will be closing on Friday, September 15th at 5 p.m. Pacific Standard Time. So this is my request for you. We definitely need you to not only do step 1, but step 2, but also complete your application before this deadline. And we're asking that please do not wait until the last minute, because there may be, too many people in the server and etc. So if you guys can get them in as soon as possible, we would really appreciate it. Because as you know, with these applications, there's a lot of stuff or work that we're doing in the back end, and we would just appreciate if you can get your application in as soon as possible. Some helpful tips. As I mentioned earlier, to prepare your application, we are going to reference this PDF version. If you print that down, you will see the questions that we ask, and then you can prepare your responses. You can prepare what you need through drafting and saving an application on a Word document, because there are some written responses. We want you to check your word counts, and this will give you access to your responses to the application after the application period closes. As I mentioned before, once September 15th at 5 p.m. closes, we don't have access to the application to make any changes, and neither will you. And another thing regarding their written responses, they're either 150 words or they're 250 words. And my recommendation to you is just be clear, concise, and to the point when you're doing those responses, okay? And another important fact is when you're in the submittable platform, that you want to make sure that you're saving your work throughout the entire process, so all that hard work that you're doing is captured. So items needed to complete the application. Here's a little checklist of things that you may want to have with you as you're going through the application. One is your board-approved annual budget. We want the most current board-approved budget. And we understand budget cycles end in June, and sometimes they end in December. So once again, include the most current for your agency, okay? If you are fiscally sponsored, we want your agency's budget, not the agency that is sponsoring you. And we realize that some of the budgets, some of your agencies are large, and let's say you're applying for a certain project, we're actually wanting, your entire budget of your agency. And through the application, please let us know that, if your agency is super large and you're really focused on this project, this is a good time where the video that you need to submit, you can kind of like tell your story there. Other things that you'll need to complete the application is the number of unduplicated clients served per year, the C-suite board and staff gender and ethnicity data, the client served gender and ethnicity data. Some attachments that you'll need: the IRS letter of determination, your Form 990, your agency logo, and a 3-minute maximum video with answering the prompts to showcase your agency. So how are we going to evaluate all these great applications that are coming in? So we have a team of 5 that will be reviewing these applications, and all applications will be reviewed and scored by 3 of the program team members. We are going to take a holistic review of evaluating these grants with some considerations to be taken as we're scoring these applications. Mission alignment. I read our mission earlier, so keep that in mind. We want to prioritize communities with greatest health and social inequities, your organization's evaluation practices, a racial equity focus, you're addressing social determinants of health and or systems change. There's certain focus areas that are already included, but if you need to add a focus area, we've also added space for that as well in the application. Services, activities, your depth and breadth. So what are you providing to our community? We really want to know what you're doing out in our community and how you're making it better. We want to look at your budget and financial strength. And overall, we were looking for some cohort considerations to ensure diversity in geographic location, populations, communities served, types of services and activities, size of organization, new or returning grantees. Here's a timeline to give you kind of perspective on what we are looking to do. Right now, our applications are open. We're out doing the Ask the Funder session, which you are in today. We are offering office hours for technical assistance until September 12th. And then during September 18th through October 27th, our program team is going to be reviewing these applications. We are going to prepare recommendations for our committee to review on November 28th. And then we provide those recommendations for board approval on December 15th. The program team will share the decision with all applicants, hopefully before or around January 2024. And I want to make sure that, once you're awarded, we will have to do grant agreements, and then we'll also notify those that did not get awarded. And also just being mindful that the Alliance Healthcare Foundation offices are closed between December 22nd and January 2nd. So that is why we were saying that the decisions will be made in January. In addition to this timeline that we're also adding, in January, February, we're going to be having debriefing sessions, kind of like our office hours, being offered for those agencies that do not get awarded, maybe giving some advice or guidance if you need it. And also we'll be doing a grantee perception survey for all the folks and agencies that submit an application, just to learn, what we're doing good at and great at, and where we have areas for improvement for the next cycle. So a little bit about the submittable application overview, getting into the little bit of the weeds, and I might have to repeat myself a couple of times here. There is 2 steps to the application in submittable. And the first step, which we call step 1, is our intent to apply. And like I mentioned, once you have completed step 1, you will get an email with a link to complete step 2. After you receive this email, you're ready to complete your application. And step 2 is the full application, and we will need to receive both steps 1 and 2 for this to be considered a full application. And once again, you're going to hear me say September 15th, September 15th, September 15th. But this is a reminder that all of your information needs to be in by 5 p.m. that day, and we ask that you do it a little bit sooner. So in the application, there's different prompts that you're going to need to fill out. And one of them is, one of our eligibility criteria is you need to be a 501c3 or be fiscally sponsored by a 501c3. So if you are a 501c3, you would definitely click that first box. But if you are a nonprofit, if you're a nonprofit that is looking for a fiscal sponsor or being fiscally sponsored, you would do that second button. You will fill out all the information here for your agency. The only time that a fiscally sponsored agency will help you is that you will need their EIN number and their letter of determination. If you're fiscally sponsored, those are the 2 areas where they're going to help you with. Okay. The rest of the application you will fill out for your agency. Annual budget. In the annual budget section, we are looking for your current annual budget approved by your board, and you will fill out the table using your budget numbers, and you put them directly into this table. And a reminder, if you're being fiscally sponsored, you're adding your agency's budget here, not the agency that is fiscally sponsoring you. We understand some budget cycles end in June and December, so include the most current budget for your agency. Let's move on to the demographics. There are several tables here that are showing demographics. One will be for the board staff and your C-level staff, and one will be for community served. So to capture this data, what we're looking for is to fill out for, let's say, the gender, right? You will fill out female, male, non-binary, prefer not to answer, and unknown. And this year, we have added another component. But before I get to that, your gender representation, female, male, non-binary, and preferred not to answer, those all need to total 100. And as you're putting them into this table, they will populate, but you need to make sure that that number comes to 100. And then, as I mentioned, this year we've added a new question, and it is about trying to be inclusive as much as possible. So we've added, if of the population listed above, what percentage identifies as transgender? Granted, if your agency collects this data, please add it to the response here. If you do not know, or if this data is not collected, just enter a 0 in that field. Okay. Now moving over to the race representation percentages. Here we've combined them because it will give us a better picture of who you're serving. And once again, as you are serving your clients, you can populate this table. So as long as it's adding to 100. The simple smartphone video. At the end of the application, you will have the opportunity to include a simple smart video that is 3 minutes maximum. And what we mean by this is, use any type of cell phone and record your answers to the prompts up to 3 minutes. And another thing with this, we're asking for a 3 minutes maximum. So if you go over the 3 minutes maximum, the scoring team will only evaluate the first 3 minutes. So if you're thinking, I'm going to do a 5-minute video because I really want to I have a lot of things to say. But in all fairness, we're really going to evaluate the first 3 minutes. And here are the prompts. Describe how your organization is working to achieve its mission and how you measure success or impact. And the next prompt is, what are you most proud of? Biggest success over the last year or two, and biggest lessons learned over the years. And, why are we asking this video? This is your time to tell us maybe something that wasn't captured in the application, something that maybe you need to clarify, but going through these prompts. Okay. And this is a way to kind of make your agency shine and then tell us that story that we really want to hear. And another question that we get is, who should do this video? Should it be our chief executive officer? Should it be our executive officer? Should it be our director of programs? Should it be our outreach manager? Should it be a client? That's up to you. It could be one person, it could be 2 people, it could be a group, as long as they can answer these prompts and tell their story. And be mindful, just 3 minutes maximum, because that's what's being evaluated. And honestly, have fun with it. Be creative. Remember, there's 5 of us that are going to see these videos. So, get to the point, have some fun with it, and really showcase your agency as best as possible. So we're coming to the question and answer period. I'm hoping that you've added some questions in the Q&A, and just so that and some other areas that if you didn't ask a question today, you can always connect with us, Barbara and Melanie, on the Calendly link that I'm hoping Anthony is dropping down right now. They're 15 minutes, and they're going to be going we meet Tuesdays and Thursdays from 1 to 3 p.m. And if that time doesn't work for you, you can always email your questions to grants@alliancehf.org. And then, of course, our website has a lot of this information already there, and it's at alliancehf.org. I'm hoping that is getting dropped in the chat as I'm speaking. So with that being said, I'm going to move over to my other device so that I can answer some of your questions. So here we go. Let's see who can stump Barbara. So the first question is, my organization has a lot of different programs. During office hours, can you help us narrow down what we should focus on in the application? And my answer is going to be, office hours are meant for technical assistance only. I wish I could help everybody, but we can't. So the office hours are basically to ask questions how you should, you had a question regarding one of the questions. You can't move forward in step 2. We had a glitch in, putting the table together, those type of technical questions that we are willing to entertain. So if you think you're going to do office hours and try to pitch your agency, think again, because we will say, okay, what is your question? Will you send out the PowerPoint after this session? And what about the recording? So yes and yes. Actually, the slide deck is already on the website, but we will share it with you as a thank you for attending. And also the recording will also be shared with you. I'm using a fiscal sponsor. Should I include their information to answer application questions about the budget, demographics, etc.? The answer is the only information that you are using for your fiscal sponsor is the 501c3 letter, which is the letter of determination, their EIN, and the Form 990. The rest of the application should be your agency's information. Question, do I need to complete the application in one sitting, or can I save it and return it later? Will I be able to save a copy after the deadline? So the question is, do you need to complete the application in one sitting? The answer is no. You can always save a draft and come back to it. But what I also will suggest is don't add a new account. Go to the existing account and add it in there, because we are seeing a couple duplications. So we would rather just have one application for step 1 and then also save it in step 2. And then the next question, will I be able to save a copy after the deadline? My recommendation for you with that is, if you have a PDF or a Word document that you are working on, I would save that, for your responses that you provided for this grant. Can I apply if my organization serves both Imperial Valley and San Diego? So you can apply. So there's 2 mission support grants going on right now, one for San Diego and one for Imperial Valley. So my answer to you is apply for our mission support for the San Diego Mission Support Grant, and then also apply for the Imperial Valley Wellness Foundation Mission Support Grant for each county. Next question. We're a small organization and don't have a website. What should we do for that question in the application? And my answer to you is, if you don't have a website, I would use one of your social media platforms, such as Facebook or LinkedIn, to add there. Can we apply if our organization provides direct healthcare services? I know the application mentions you focus on social determinants of health and systems change. So are we eligible? So yes, you are eligible. We are focused on organizations that close equity gaps. So make sure to focus on that in the application. Another question, will grants be equal amounts each year for 3 years? And the answer is yes, they will be equal amounts for 3 years. And as an example, let's say you get grant awarded the $25,000 at a $25,000 level. So you will get it in 2024, 2025, and 2026. If you're not selected for the grant, will there be opportunities to get feedback about our application? As I mentioned earlier in the timeline, we have added some debriefing sessions, or we will be adding debriefing sessions in January to provide some feedback on your applications for those that would like it. And also, we're going to be sending out a survey for a grant. It's called a grantee perception survey on how we did this application cycle. What if our organization does provide social determinant of health services, but they aren't listed on the areas of focus in the application? Should we not apply? So the answer is yes, you should still apply. We have added, I think, 11 different areas of focus, and it's also in our FAQs. And we understand that we may not cover, it doesn't cover everything that all these nonprofits are doing in San Diego. So what I suggest that we have left some blanks. I think it's area focus 1, area focus 2, area focus 3, etc. And what I would do is I would add your focus in one of those areas. Okay, so that's how we would address that question. Are these slides available online? Well, you will receive an email with the slide deck, but it is also online in our at alliancehf.org. And also, if you click the mission support button, which is right on the front page, it'll get you to all this great information. For the leadership profile on the application, can it be the VP or does it need to be a senior VP or signatory? So for us, leader refers to president, executive director, chief executive officer, senior VP, etc. So you can use who you identify as your leader for this application. Are private nonprofit colleges eligible? So there is some eligibility criteria that you would need to review. And just to kind of give you a few, you need to be a 501c3 or 501c3 fiscal sponsor. You need to be located in San Diego County and serves communities in San Diego. You need to be aligned with our mission and have an ability to clearly demonstrate impact, be focused on eliminating equity gaps and addressing social determinants of health. And a strong preference will be given to organizations who serve at least 60% of people or more of the Black, Indigenous, people of color clients. Could you go over video submission in greater detail? Okay, basically greater detail definitely needs to be in 3 minutes. I would definitely, if you have a cell phone, you use your cell phone to video record your message by answering the prompts. And then you would have to download or save the file so you could put it into our system. And you definitely need to answer the prompts. The prompts are describe how your organization is working to achieve its mission and how you measure success or impact, and what are you most proud of, biggest successes over the last year or two, and biggest lessons learned over the years. And if you want more information about how to download that into the application, I would definitely sign up for our office hours or send us an email at grants@alliancehf.org. Next question. After submitting step 1, if AHA determines that the application is not a good fit, will the applicant be informed at the time before submitting step 2? Actually, we will not have enough information when you do step 1. So the way that we're going to be doing our quality assurance with all of our applicants is in step 2. So we would not be able to see whether you qualify or not until you fill out the application. But I would refer you back to our eligibility criteria 1. And if you want to set up an office hours or send us a question in the grants@alliancehf.org, email us, set up a office hours. And also with the, and just to kind of go off, it's not a question, but I wanted to kind of let you know, if you do email us at grants@alliancehf.org, we will try to get back to you within 1 to 2 business days, okay? Do you have specific metrics or outcomes you expect grantees to achieve? Well, as we were saying in how we're evaluating these applications, there is some considerations that we are taking for all these applications. I think with each application being scored by 3 of the 5. We're being very deliberate in how we are scoring our applications, and then the team's going to come together and then talk out like our top 50 applicants, and then we'll go from there. I would like to, I want to reference you back to our FAQs and to the slide deck. I believe there is some, the holistic review of considerations is also there. I have 5 minutes left, so I'm going to try to get through some of these questions. So please bear with me if your question is not answered. If your question is not answered during this time, then we will definitely try to reach out to you one-on-one. So the next question, is there a preferred format for the 250-word questions? Is paragraph, bullet points appropriate? So there's no preferred format, but remember, you have 250 words. So I would be short, sweet, succinct, and get to the point, right? If you think bullet points is going to get you there, do it that way, but you just need to make sure that you can convey what we are asking. Is there a required font point size? No, there isn't a font size that we're looking for. It needs to be normal font size so we can read it without the use of magnifying glasses. Somebody's being funny here. I have 3 folks doing these questions, Melanie, Karen, and Anthony, and I have a feeling that might be one of those, but definitely make sure that we can read it. Should we ask for a specific amount when applying? So, as I mentioned earlier, we have $900,000 in this pot. We are looking for 25 to 30 awardees or agencies. So Alliance Healthcare Foundation, with that budget, we are going to set the amount for each agency. So some agencies may get 25, some agencies might get 30, some agencies might get 35, depending on the application. Okay, so there isn't a place there where it says, you know, how much money or how much funding you would like. So that's something that we do internally. Are there any events, workshops, or networking opportunities that grantees can participate in? So are there any events? Well, besides this, Ask the Funders session that we're holding, and the office hours, and the website that can give you all this information, that is what we are providing for you to help you through this application process. And I would definitely, if you have any questions, any extra questions, you know, sign up for an office hours through the link, through Calendly link. Okay. It looks like we're going to be wrapping up. And I want to thank those that have submitted questions. And if we didn't get to your question, we will reach out to you directly to try to answer them as best as we can and within the next couple of days. Okay, we want to thank you for joining us. And I want to thank the team that's behind the scenes. I have Melanie Mijares, our program associate. So a round of applause. Karen Winston on the question and answers, and Anthony Gwynn doing technical support and question and answers. So I want to thank the team that's helping me today behind the scenes, because without them, I wouldn't be able to do this without all these screens that you guys cannot see operational. And once again, office hours, Tuesdays and Thursdays from 1 to 3, our email, or you want to email the program team. You know, I just want to make sure that you guys, you know, do a great job with your applications. We look forward to receiving them. And if you can do them before September 15th, you'll get a bonus. No, just kidding. But we would appreciate it if you get it in before then. So thank you everyone for joining us. Take care.